statement today. And Mr. Chairman, I think that the information we've gotten in this hearing has been most helpful in understanding how we're doing and moving forward, and also in having some significant appreciation of the chores which yet remain. I think if we all are willing to work together, we're going to see this program be a good one of which we will all be proud. Mr. Larson, you made some points here. States are already using, in your statement you said, states are already using this authority to save money for families and small businesses. Start out in New Mexico. The State Insurance Division denied a request from Presbyterian Healthcare for a 9% rate hike, lowering it to 4.7%. In Canada, the state stopped Anthem Blue Cross Shield, the state's largest insurer, from hiking rates by a proposed 12.9% instead of limiting it to a 3.9% increase. In Oregon, the state denied a proposed 22% rate hike by Resurgence, or rather by Regency, limiting it to 12.8%. New York, the state denied increases for Emblem, Oxford, and Aetna that averaged 12.7%, holding them instead to an 8.2% increase. In Rhode Island, the state denied rate hikes to United Healthcare of New England ranging from 18 to 21%, instead seeing them cut to 9.6 to 10.6%. I know what you're telling us, that these provisions are working in terms of assuring the protection of consumers.
That's right.
Is that a fair statement?
Yes, sir.
Now, we've talked a little about the health insurance exchanges. You will note that as you've indicated, CSIO is charged with helping states set up these exchanges. Isn't that right?
Yes.
How will these exchanges change consumers' experience in purchasing health insurance on the individual market?
Well, individuals will now have access to a competitive market, an affordable market.
So he'll know what he's getting?
They'll know what they're getting. They'll get comprehensive coverage, and they'll have the ability to get tax credits if they meet the criteria.
In a simple, understandable way?
Yes.
So that the purchaser of the insurance policy will be able to understand what he's buying and what the advantages of the different plans might happen to be. Is that right?
That's right, exactly.
And you're going to need to be a Philadelphia lawyer to understand this. Is that right?
That's right.
So in addition to improving the market for individual coverage, then we must assume that the exchanges will also provide for small businesses to have, for the first time ever, the ability to pool their risk and buying power together to drive down costs. Is that right?
That's right.
Now, there seems to be some misunderstanding here. Insurance companies over the years have been forced to go to the idea that they will avoid the risk because they didn't have a decent insurance pool. So what they did is they curtailed the size of the pool by getting rid of the most risky people, and that's why they used pre-existing conditions and other things to prevent people from, certain classes of people from buying insurance. Is that right?
That's right.
So now the insurance companies are going to be able to engage in the practice that is so important in terms of having real insurance. They'll cover everybody.
That's correct.
And this is going to enable insurance companies to then practice insurance in the classical sense by making it available to all persons, and then we will all share the risk that flows from the possibility of sickness or illness or debilitation. Is that right?
That's correct.
All right. And this is one of the main ways in which we're going to see significant savings of monies to the federal government, to the employers, and to, of course, the purchasers of the insurance. Is that right?
That's right.
Okay. Mr. Chairman, I'm going to surprise you. It's 38 seconds. I yield back.
All right. Thank you, Mr. Dingell. Dr. Burgess, recognized for 5 minutes in our second round.